And once again, we have Mr. Marcos Mejia, who's here from Sonoma County, to be able to give us an update about what's going on with COVID, the vaccines, and other information. And so welcome once again. What information do you have for us this week?
Thank you, Rafael. Well, I can tell you that the vaccination continues making enormous progress, although we're in a slow pace again, just like we were last year, which means that the majority of the people has been vaccinated, but we still have that 12% that is more reluctant to do it. Many of them continue to get vaccinated as they get convinced, or they got sick, or they heard of someone who got very sick with COVID or many other reasons, but they end up getting vaccinated. However, not everyone, and that's okay, that's fine. We don't expect that everyone is going to do it. Our goal is to vaccinate the most possible people. And in that regard, more than 1,009,000 doses have been administered to Sonoma County residents. And we are closing 81% of the county's eligible population, those 5 and older. They are fully vaccinated, almost 81%. That's a great base. That positioned the county at number 10 of the counties in California. The number 10 is a good place because there are 58 counties in California. We are number 10 in vaccination so far. Those numbers move according to the amount of people that gets vaccinated. In addition to that, we have 7.1% of the county's population that is eligible, partially vaccinated, and 64% also have received boosters. Boosters are the way to protect people against the worst outcome of COVID, which is the severe illness, hospitalization, and death. On the other hand, people who are unvaccinated right now in Sonoma County are 2.5 times more likely to be infected, 15.3 times more likely to be hospitalized, and 10.9 times more likely to die than those that are vaccinated. The numbers continue dropping, but we are still in a moderate level of dispersion of COVID, which means it is still here. So for every 100,000 persons in the county, 15.3 is the number of people that is getting infected with COVID. When we look at these numbers, the unvaccinated people is more affected by COVID, with 39.2 for every 100,000, compared with the 12.1 for vaccinated residents. This is an average. These numbers are an average that is measured weekly, 7 days periods. That's how we get these numbers. Our overall testing positivity rate is 5.2%, and our equity metric testing positivity rate is 5.8%. And I'm happy to see these numbers getting closer more and more. We used to have huge disparities in the lower quartile, which is where the lowest incomes residents are grouped in this for purpose of metrics, statistics metrics. The hospitalizations also continue to drop. There are 31 persons in the hospitals in the county, and 5 of them are in the intensive care units, sadly. And that's a good thing. The numbers are still in the right direction, but we are going to continue promoting vaccination for especially the pediatric, because there are still more than 50% of the kids 5 to 11 that are not vaccinated yet. And yes, this began in November, it's still recent, but when we go to the next number, 12 to 17, sorry, that group is still lagging with 32% more or less that is still not vaccinated, and that vaccination began last year in May. So we need all those kids to get vaccinated. Changing the subject a little bit, the county has aligned with the states on masking changes. As we know, masks are no longer required for unvaccinated people in California, but we have moved from a requirement to a strong recommendation for all individuals, not just the unvaccinated, vaccinated people too. Whenever you go to indoor settings, we strongly recommend that you keep using your mask because of these numbers that I just mentioned. The virus is still here and can continue spreading. There's 12% of the population in the county that is still not vaccinated, And we know also that even if you're fully vaccinated, we still have Omicron around. Even if you have a booster, you still can get it. And the problem if you are vaccinated and you have your booster is that you may not even know that you have it, because this group of persons are asymptomatics, which means no symptoms, or their symptoms are really mild. So the best you can do is protect yourself wearing a well-fitting mask, a respirator. We're recommending the N95s, and doing the COVID test that now are easy to find. The antigen or rapid tests are easy to find. They're everywhere. If you have insurance, you can be reimbursed for up to 8, and that gives you the opportunity to test twice per week. If you don't have insurance, community centers are helping with this. And also the government is giving another round of COVID tests for free to every American, and you can request those in covidtest.gov, this website where you can just require a new round. But the responsible thing to do is that if you are very exposed to the public because of your job or because you went on vacations or business trip or or whatnot, any situation that can expose you frequently to the public, well, the best thing you can do is to test constantly and wear your mask. As always, local jurisdictions may have additional requirements beyond the state guidance. Sonoma County will align with California on the masking and other changes, but we are continuing to observe closely the numbers. And if we go very high in the numbers, we may come back with recommendations or restrictions, but we're not yet there. Let's stay positive, thinking that we're going to continue in the right direction as we are now. And for everyone, it's important to note that businesses, venue operators, and hosts may choose to require all patrons to wear masks to protect staff and patrons. County health officials continue to stress that it is important to respect the choices of others when it comes to masking. Now, there are two subjects that we have observed over these 2 years of pandemic. And one is the natural immunity versus vaccine immunity. Some people have these debates that natural immunity is better than vaccine immunity. And what I have to say about it is that getting sick with COVID can offer some protection for future illness, and that is called natural immunity. But the level of protection people get from having COVID-19 may vary depending on how mild or severe their illness was, the time since their infections, the underlying conditions they may have, along with their age. Getting a COVID-19 vaccination is also a safer way to build protection than getting sick from COVID-19. COVID-19 vaccination helps protect you by creating an antibody response without you having to experience sickness. Getting vaccinated yourself may also protect people around you, particularly people at increased risk for severe illness from COVID-19. Getting sick with COVID-19 can cause severe illness or death, and we cannot reliably predict who will have mild or severe illness. If you get sick, you can spread COVID to others. You can also continue to have a long-term health issues after COVID-19 infections, which bring me to the next subject, which is resonating more and more, and that's the topic of long COVID. And long COVID, look, most people with a COVID-19 infection get better within weeks of their illness. However, some people experience symptoms past the point of active infection, and that is known as long COVID. Nowadays, after 2 years of the pandemic, there is an estimate of between 10 and 20% of the COVID cases that have resulted in long COVID. These are a wide range of new, returning, or ongoing health symptoms that people can experience 4 or more weeks after being infected with the virus. Even people who did not have COVID-19 symptoms in the days or weeks after they were infected can have long COVID symptoms as well. These conditions can present as different types of combination of health problems for different lengths of times. People commonly report experiencing different combinations of the following symptoms: difficulty breathing or shortness of breath, tiredness or fatigue, difficulty thinking or concentrating, This sometimes is referred to as brain fog, chest or stomach pain, headaches, fast beating or pounding on the heart, also known as palpitations, and joint or muscle pains. Some people who have severe COVID-19 symptoms experience multi-organ effects or autoimmune impacts over a time with symptoms lasting weeks or months after a COVID-19 illness. Multi-organ effects can affect many, if not all, of the body systems, including the heart, the lungs, the kidneys, the skin, and also brain functions. Autoimmune conditions happen when your immune system attacks healthy cells in your body by mistake, causing inflammation or tissue damage in affected parts of the body. While it is very rare, some people, mostly children, experience multisystem inflammatory syndrome known as MISC, or simply MIS-C, during or immediately after a COVID-19 infection. MISC is a condition that occurs where swelling is persistent, and that could lead to a long COVID as well. Now, the best way to prevent long COVID-19 conditions is to prevent the illness from COVID itself. And for that, people who are eligible can be vaccinated against COVID-19 because it's the best way to prevent getting COVID, and also is the best way to protect those around you. And that concludes my report in English.
Thank you, as always, for taking the time and being with us. And again, there are some individuals who will listen and will be grateful, and there are some individuals who will continue to challenge the science and may have to find out on their own, unfortunately, the consequences of getting COVID, either for themselves, family members, especially children who haven't been vaccinated. So with that, we want to thank you as always, and we look forward to our next conversation.
Thank you. I'll be here next week, and have a nice week.
You too. Bye-bye.
Thanks. Bye.